Well, tonight, as state leaders prepare for the reopening phase, one of the first areas they're pointing to is the operating table. Next week, an executive order temporarily banning elective surgeries will end. But as Katie LaGrone explains, these non-emergency procedures will come with a whole new set of rules for both the patient and the doctor.
You've seen the hospital system hold up.
During a recent press conference at Tampa General Hospital, a seemingly relieved governor announced how he plans to reopen the Sunshine State.
Slow and steady wins the race. It's going to be very methodical.
And pointed to healthcare as the first area to bring business back. A surgeon at the hospital eager to add,
we are getting ready to be open for business.
Elective surgeries are at the top of the list. These non-emergency procedures were halted in March as concerns increased about the spread of COVID-19, causing shortages of medical supplies and patient beds. Now there's a backlog. All medical eyes on bringing them back. Elective surgeries are pricey and profitable.
It's very exciting and good news.
Dr. David Shapiro is an anesthesiologist and serves on the board of the Florida Society of Ambulatory Surgery Centers. He supports resuming elective surgeries as long as it's slow, steady, and with increased precautions.
I think things will look a lot different to patients.
At his own facilities, that means fully masked staff, empty waiting rooms for families, and patients everywhere can expect to answer more personal questions, undergo more testing, and possibly longer waits.
We might just start a little bit slower, doing fewer cases, again, to allow for the maintenance of our supplies, also allow for as much social distancing as we can. We may want to go to every other bed, just like the airlines are scheduling flights with the middle seat empty.
But while the healthcare industry is gearing up to welcome in patients, are patients ready to come back?
Just because everything has been lifted doesn't mean it's necessarily safe.
Adam Cohen's grandfather was scheduled for an elective heart valve replacement in Palm Beach County this summer. Then the coronavirus hit. Now he questions how urgent is his grandfather's elective surgery, and when the state resumes these procedures, will medical centers be safe?
How safe do I feel having my 95-year-old grandfather going into basically ground zero for coronavirus these days? I don't want him going into a situation that's even possibly unsafe.
Doctors acknowledge medical supplies and medications are still in high demand and short supply, but they're preparing in ways they only know how.
It's going to be tough, and it's going to require a lot of understanding and effort on everyone's part.
Florida hospitals and surgery centers expected to start offering elective surgeries within days after the governor's order restricting them expires on May 8th. Katie LaGrone, ABC 27, investigates.
More elective surgeries means there is an even greater need for blood in the state. Tonight at 6, we'll tell you how you can help.